I want to hear from the staff. First of all, thank them for the support that they've lended me throughout this process and the years that we've worked together as a team. But more importantly, I want to share just a glimmer of what my vision is for my first 100 days as the Chief Executive Officer for the ADAMSHS Board. So that's day one. My top 3 focuses for the first year as Chief Executive Officer will be is to continue to investigate how we can get ahead of, if at all possible, this horrific heroin crisis. With the combinations of the new fentanyls that's constantly changing, the challenge is enormous. So we can't do this alone as the ADAMS Board, so we have to continue our collaborations with the Opiate Task Force, with the Medical Examiner's Office, with the county and city departments of health. So that's one of 3. Second, I really need to remind everyone that we have a continuum of services that we label behavioral health. So that's inclusive of kid services for our pregnant moms to our older adults. And I have to say that when I first started, older adults meant 55. So as CEO, I'm going to change that age criteria now that I've well surpassed that. But so I want to remind folks of the continuum that has many holes, primarily due to funding, as well as the restructuring of how services are provided. We have a whole new audience that we have to pay attention to. We have a growing, alarming number of homeless youth, some with children. And so that's a target population that at a minimum we know they've suffered some trauma. So I want to get back out into the community and find out what are some of those gaps that we need to pay closer attention to. We've admittingly diverted most of our funding to try to get ahead of this heroin epidemic. But as a part of that, we're going to grow our prevention and early intervention. And that's the third leg of the stool for me in my first year. That's huge. I think the common person doesn't understand the full definition and scope of prevention, and certainly don't understand early intervention. So we need to educate and inform our community. I know that because funding is really going to be very tight, that we have to familiarize ourselves with our gaps in order to, and the only way to do that is to get out into the community and find out from family members, for those who used to receive service, why did you stop, what are some of the current needs. I think that we also need to engage not just the public sector, but the private sector. And that's one of my main goals that we've not done in a long time. First of all, I've learned that networking is essential. I've learned that knowing your audience is essential. I've learned that being a person of your word, which I feel as though I've always been, but how critical that is in a position of leadership for a very, 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 very needed service in Cuyahoga County. I've also learned how to say no. There are some times when we have to say no. Yes, we would love to fund the trombone player that's in front of Playhouse Square at times, but we can't. But we're going to call you when we can. And I've watched and witnessed those opportunities to come full circle. And he has an amazing way of speaking with individuals and getting the point across around the role and the mission of the ADAMSHS Board, and that we save lives. I mean, and it's not a tagline, it is our world. And all of our efforts in programming and in growing our programs or enhancing services is to that sole purpose, to save lives. I'm adding save lives and inform the community, because I think that it's very important that folks are aware of not just who the ADAMSHS Board is, but where can I go for resources and support if these situations or characteristics or unusual behaviors are presented in my family, my neighbors, my community, my church. So I know that I'm going to be tirelessly working in the community to say, these are the resources that we have. Do we have enough? Never. But let me tell you where you can go for help. So that's kind of my mission for my first year, is to reacquaint myself with the community needs. I've always been a direct service worker. I want to get a little bit back to that, if you will. and then help to fund and be a big mouth, some call it advocating, to express dollars, to express for more funding to support our initiatives. So what have I learned? Oh, I've learned quite a bit. I've learned to know your facts, in which I'm always a sponge for information. I've also learned to be able to hand who I'm speaking to something about the board. Data seems to be the way that our system is driven for funding considerations. So we need to talk about outcomes. The other thing that I've learned is because of how savvy the chief is, he's been able to convene a group of individuals who have successfully beat their battles of addiction. And that group is so powerful. They've gone to schools, they've gone to community meetings, they've testified in Columbus. So it's a nice core group that I like to see grow as part of my mission. I think that it needs to be more diverse, both in ethnicity, age, and gender. And so those are some of the things that I want to see continued as part of his legacy. And of course, the awesome work that he's done with law enforcement. There's absolutely no question there. Fortunately, I was at the beginning of our crisis intervention training initiative and was very hands-on, so I know the model, and I've been working with the team here to stay abreast of some of the changes as we've integrated alcohol and other drugs. It was a core mental health model initially. So again, his passion in working with law enforcement, I believe that I can continue it. It's going to be a few tweaks. I have a little different style than the chief, but certainly our mission and our passion is spot on. I want to add that thank you for this opportunity. We certainly need media as a means in which to spread the news, both the good, the bad, and the indifferent. We will be working towards hopefully having consideration for a mental health, alcohol, and other drug levy at some point, and that will be under my leadership. Talk about continuing the legacy in which the chief has already planted the seed. We need to see that through because we desperately need more funding.